my degree in pharmacy in Egypt in 1999. Worked some period as a pharmacist in Egypt. Then I joined pharmaceutical sales industry in Egypt. Worked for about 4 international pharmaceutical companies. Then in the last 6 years, I was promoted as a sales manager, managing sales over the country, and I did my MBA. And actually, I plan to go to Canada in 2004, and actually it takes a long time now, like 4 years or so. So during this period, I was waiting for my visa approval. And my second question may be, so why thinking to come to Canada? First, Canada is one of the countries that really welcomes new immigrants. It gives a very good career for internationally educated health professionals. It's a peaceful country, very good in education level for children, and very good healthcare level. And like all we know that BC is the best place on earth. Okay, so like I said, my plan started back in 2004 by applying for immigration to Canada, and it takes lots of time now because many people are applying to come to Canada for immigration. And during this meantime, once the embassy started to contact me, then I started to think seriously to execute my plan. So I started actually by making the IELTS test, and luckily I consider myself one of the lucky person because actually I studied back in Egypt in English since grade 4, and I studied in my faculty by English too. So I did my IELTS test before coming here in Canada in April 2008. And my plan was starting to approach the Pharmacy Examining Board of Canada to do 3 exams, which is evaluating exam and then qualifying exam, which is a written part and the OSCE part, which is the most scary part, especially for internationally graduated students, because it's totally different exams than we had in our countries before, because it's a communication exam based on English, and it's different standard, different Canadian standards that we don't know in Egypt for sure. So I did my English test in April 2008, and then took my evaluating exam in July 2008, once I arrived in Canada in June 2008 actually. And after that, I started looking for a job, and I said to myself, so I have to look for a job as a pharmacy technician to get used to the Canadian cultures and how pharmacy business is doing in Canada. So I took a part-time job 2 days a week in Zellers. And at this time, actually, I faced many challenges, like it's a new country, for sure language barrier, it's a different culture, and there's for sure monthly expenses, that kind of stuff, because I have 2 daughters and I'm married, I have to care about my family too. And studying and exam sure, which is not an easy job. So like I said, in July 2008, I made my evaluating exam, and I worked as a part-timer pharmacy technician at Zellers Pharmacy in Coquitlam Center, and it was perfect for me because it allowed me to get a chance to study, because the written part of the qualifying exam, which is part 1, is really hard one with lots of materials, and I was really discouraged in the beginning. But I said to myself, I have to focus, and I have to do the exams, and I have to get a chance. So I was working as a part-timer 2 days, and I wrote my qualifying exam in November 2008, and I passed it. And the second step that I have to do is searching for a mentor to do the practicum test. So it's a practicum period, which is 3 months, 500 hours. And I did it with Overweighty group, which I'm working with now, Civil Pharmacy. And I really was lucky with my preceptor because he was really dedicated for my success. He gives me lots of experience and lots of exposure to customers and how to counsel these people. Excuse me, sorry. And in this step, I really encourage each and every pharmacy student, international one, to do the practicum as a volunteer and work hard as they exactly paid. Because here in Canada, once a person is dedicated to do his job and is doing a good job, for sure he will be paid off for education and training opportunities. And the most scary part in my job was the OSCE test, which is totally different exams than we have had in Egypt. because it's an oral test and it's 16th station, And once I got my license, I met with different UBC students, which was really concerned too about that exam, because it's a different one, and it totally depends about the communication level and the English level, and how to interact with the patients or the persons that acting as a patient in the exam. And there's an assessor who assesses each and every case and giving marks all the way. So I did the OSCE test as well in May 09. And the result has been released on the 30th of June 09, and I got my full-time job with Overweighty Food Group starting last July. And actually, my success steps is I consider myself have a really adaptable mind, because here in Canada I had to start with an entry-level job, and I know that lots of people can't go to this step easily because they look back in what they were doing in their countries. They probably have 3 or 4 pharmacies owned, and they were managers and was dealing with a high-level job. And here they have to just go with entry level to be acknowledged as a professional here and to do the exams, and which is really need an adaptable mind to start again all over, especially after being graduated over 10-15 years. Second tip actually is the focus. And people here need to be focused on what they are doing in exams, because exams is not an easy job, but actually it needs to be focused. So I said to myself, I can do it, not just I need to be focused on it. So I dedicated myself over a year just to do the exams, and I limited my social gathering and everything like that just to do the exams, which is workable for me. And I had also to confront all obstacles, like exams, different culture, language. And I do really here acknowledge the role of Douglas College, because I worked with different career consultants. I remember Christina and William, and I took like many psychological supports and mental support, and okay, Nina, you are on the right track and everything is okay, and for sure the financial support for the exams. Associate with positive people that really encourage you to go on the track. And just disregard all people that really try to discourage you and saying, oh, you can do it, it's very hard, it takes years. No, it doesn't take years, it just needs a focus and concentration on doing the exams, and it can be done in a year. And just I need to say that you will always miss 100% of the risk you don't face or don't take. And I again thanks Douglas College, thanks Ella, William, and Lois and Judy for giving me that opportunity. And I'm ready to help any international pharmacy graduate on doing the exams. And my email is down here. Anybody really needs any help in doing the exams, study materials, I'm ready to help anyone. Thank you so much.
See what I mean about single-minded determination? Yes. Okay, I'd like to introduce the next client to you. Her name is Jeanette. Jeanette is one of those rare individuals who establishes goals for herself and works toward them regardless of the number of setbacks that occur. Jeanette decided when she was a little girl that she wanted to work overseas in the healthcare field, and that's exactly what she has accomplished, twice. However, as you will hear, this did not come easily. Jeanette endured a number of misfortunes along the way, but nothing can deter this woman. As you will hear and you will see, Jeanette may be small, but she's mighty. Jeanette?